Hello, my name's John Cassell. I'm the Senior Partner of Spring Consulting Group, and I'm here to talk to you about association health plans. I'd just like to tell you a little bit about Spring, my company. We're a consulting and actuarial firm that works with many sizes of organization in the US and a number of associations of employers that get together to purchase a variety of programs as a group. And we're particularly interested in association health plans because it's an area that we've worked in for a number of years. But let me talk about what we're going to cover today. Today's agenda is going to cover what association health plans are, what are the benefits that can be gained from having an association health plan, the US Department of Labor, DOL, historical view of association health plans, how they've treated that in the past, what's changing and what makes us particularly interested now, looking at association health plans past versus present, also looking at fully insured versus self-insured programs and how captives fit into this. And what can you do now, which is something that I know a number of you are interested in. So what are association health plans? Basically, groups of employers come together with the purpose of purchasing healthcare. The rules by which they purchase healthcare is governed by the Employee Retirement Income Security Act of 1974, which those of us in the industry called ERISA. Also CMS and the Department of Insurance, the State Division of Insurance. And these programs are maintained specifically for the members that are part of the association. So what are the benefits to having an association health plan? They allow small to medium-sized employers to group together for the purposes of securing health insurance and to be treated as a large group. Existing associations and small and mid-sized businesses across the country have begun to look at AHPs and the possibility of creating one to lower their health insurance burden. So there's a number of associations that we work with and others that have spoken to us where the cost of health insurance is one of the largest burdens on their members, particularly if they're in the small to medium-sized employer group. The development of an association health plan is a clear opportunity for employer associations and other groups of employers to add significant value to their members and importantly attract new ones with a real healthcare solution. So a number of organizations that have developed programs like this find that having established an association health plan, there's something attractive that will bring new members to their organization and to retain the ones that they have. So what's changing that makes us interested in this area, particularly now? There was an executive order on October the 13th of last year, and President Trump signed this order directing the Department of Labor and the Centers for Medicare and Medicaid Services, CMS, to consider the expansion of association health plans. There were some proposed regulations issued on January the 4th of this year, and we're now in the comment period, which will end on March the 6th. So the full regulations have been laid out, and various people from the industry are able to comment on that and make advice as to better programs or adjustments to the regulations. And that period will finish and final regulations will be issued after that. Under the executive order, the definition of employer changes. So a couple of examples would be um, an employer, as far as the new regulations are concerned, would cover every employer in the same industry or profession without regard to geography. So all the lawyers in the Northeast would be covered as a group. It also covers a group in the same geography, so all employers under 50 employees in New Hampshire would equally be a group. It expands the commonality of interest provision in order to include the ability to be plan sponsors. So it means that you can be simply a plan sponsor just simply by getting together as a group to provide a health insurance plan. So groups can sponsor health plans without other business purpose. They don't have to be together because they are buying other products or sharing other services. The program can simply operate for health insurance. The program must be controlled by the members, so it's not possible for a third party to put a group together and the program not be run by the owners, the members of the participating group. There's no risk-adjusted rating methodology, so that in some health plans and some insurers have adjustments to their rates based on the type of coverage that they're providing. This isn't the case in this program, and the discrimination rules apply. Association health plans will continue to be set up as MEWAs. MEWAs are multiple employer welfare associations. It's a group structure that is used for this type of program, and so therefore that part of the legislation has not been changed. And states have the ability to regulate MEWAs. So rather than it being a federal program as far as the day-to-day running of a health plan, individual states will have the ability to set up rules to establish how MEWAs operate. So if we look at how association health plans were established in the past versus how they're established currently, the same rules, the same ERISA rules apply to both. The fact that they need to be set up as a MEWA, a multiple employer welfare association, was in the past and is now currently. But the commonality of interest has changed. It's been expanded for groups to just be established for this type of programs. Must they have a business purpose other than insurance? No, they don't have to now. And employer control is another critical factor that basically has to be established before a program can be running. So one of the opportunities in getting together as a group is that you can have sufficient employees overall to create a self-insured program. There are some advantages of having a fully insured program and some more advantages to being self-insured. So for a fully insured program, it's essentially a volume play. You have a group of employers that are getting together to buy health insurance as a larger population, and basically they can buy insurance at a better rate from an insurance company, and most will look like a larger group experienced rated plan. And that takes you so far in terms of financial advantage for forming an MHA. If as a group you decide that you want to be self-insured, there's risk and volume savings to take place. You can buy coverage for your plan networks, administration, etc., as a group. But at the same time, you can pool risk and reduce the overall cost of the program by managing risk across the entire population. And for catastrophic claims that might come through, you can buy stop loss insurance, either commercial or through a captive. So there are a number of layers to this. You can start off as fully insured. You can take a simple self-insured program, or you can take a self-insured program where the stop loss for higher risks can be funded through a captive insurance program or directly through a stop loss insurer. So what can you do in the comment period? What can you look at to prepare yourself for using an association health plan as an option? One potential direction you can go in is to hire an organization who has group solutions experience, who's worked with groups of employers, either in a self-insured or fully insured structure. And you can, through them, evaluate the appropriate risk structures for the type of group that you can put together. You can determine if a fully insured versus a self-insured structure works for your group. And if it's a fully insured structure, you can work with a selected carrier to create a program potentially as the legislation comes through. If you're self-insured, you need to make sure that your vendors have the bandwidth to execute a self-insured program and structure it so that you understand what the risks are being held in the group. And on top of that, you can determine if a captive insurance plan makes sense for the stop loss. So there are a number of considerations that you can look at to see if a program is most suited for your group prior to the comment period being ended. And then, having established the direction that you want to go in, you would be able to determine what your final group structure would look like based on the final legislation that comes through. So this is a very high-level summary of the way in which this type of plan is structured and the opportunities that are available to groups in terms of getting together to buy health insurance. If you would like more information or advice as to how to put a group together, please contact me at Spring Consulting Group, and my email is john.cassell@springgroup.com. Thank you very much.